if you look at a field like oncology, it's really one of the most incredible tensions in modern life.
Mm.
On one hand, you have this dazzling scientific progress. I mean, we hear about genomics, targeted therapies,
Right.
all these breakthroughs.
Right.
But then the actual experience of facing cancer remains this overwhelming crisis for so many people.
It does.
And today, we're doing a deep dive into some sources that argue these two worlds, the high-tech science and, the fundamental crisis of the human soul, that they have to finally explicitly come together.
Yeah, and our sources today are all about the launch of this new initiative called Science to Soul. It was created by Achyut Saroj under the AwareOnc umbrella.
Okay.
And what makes it so compelling and why we're really digging into it is the perspective of the founder. I mean, this is someone who is rooted into seemingly separate worlds.
Hard science and spiritual care.
Exactly. Hard science and formalized spiritual care training.
And the mission, from what I'm seeing, is stated pretty simply. It's to bring together solid science with evidence-informed spiritual care.
Right.
Which sounds, foundational, but the fact that you even need to launch a resource to do that, it tells you something's been missing.
It tells you a lot. It's this explicit acknowledgement that the medical establishment, in its rush for technical scientific excellence, has sort of, it's created a blind spot.
Yeah.
And it's left this huge area of patient and caregiver needs just unaddressed.
Okay, so let's unpack this.
Yeah.
Because we're talking about someone with nearly 2 decades of deep scientific experience here.
Mm-hmm.
If the science is so good, why does someone like Saroj feel the need to not just talk about this, but to go and get formal training in spiritual care? That pivot.
Yeah.
That's our core question today.
Well, I think you have to start with the messenger, right? The person. Because that 20-year immersion in oncology science was what gives this whole thing its authority.
So tell us more about that background. This isn't just a casual observer.
Not at all. The materials really emphasize it's almost 20 years.
Wow.
As a scientist, a researcher, a medical communicator, all focused on oncology. I mean, think about what that means.
You're deep in the weeds.
You're deep in the weeds. You get the molecular mechanisms, the genomic data. You can communicate these super nuanced therapies. This is someone who understands the hardware of cancer treatment.
That context is so important.
Mm-hmm.
Because it means you can't just dismiss this as some kind of, soft philosophy.
No.
It's coming from a veteran who knows the science inside and out.
Yeah.
It's not a critique of the science. It's more like an evolution of the practice.
Precisely. And the current step, the fact that Saroj is currently training to be a spiritual care provider, that's the key.
Right.
It shows a recognition that the scientific part by itself is incomplete. This is formal, rigorous training being layered right on top of that hard scientific knowledge.
And what's so fascinating about that layering is how it positions the resource they're creating. They promise, meaningful, trustworthy, and cutting-edge discussions.
Yeah.
The trustworthy part, that comes from the science.
Of course, that's the foundation.
But the meaningful part, that can only come from this newly integrated spiritual dimension.
It ensures the conversation isn't just about your next lab result. It's about your next breath, your family, who you even are now. They're aiming for discussions that are scientifically sound, but also genuinely support the person on the journey.
Which brings us right to the problem that started all this. What the sources call the great oncology paradox.
Mm-hmm.
The founders saw incredible advances in precision medicine, but at the same time, patients and families were still struggling a lot. So if the treatments are so advanced, where is all this pain coming from?
The pain point, according to the source material, it's not technical, it's systemic, and it's human. The struggle exists, and this is a direct quote, not because treatments don't exist.
Okay, so it's not the science failing.
No. The excellence of a new drug gets constantly derailed by these massive real-world barriers that technology it can't fix.
Let's spend a minute on those barriers. Because it's so easy to think, a cure is found, everyone is saved. What are the specific hurdles that make a good treatment plan just fall apart?
Well, they seem to fall into 3 buckets. Disparities, access issues, and what the source just calls real-world barriers.
So an example would be?
Think about it like this. A patient might have a genetic marker that makes them a perfect fit for a new therapy.
Okay.
But that therapy needs weekly infusions at a center that's 2 hours away, and the patient has no reliable car, or they lose their job, so they lose their insurance.
And just like that, the scientific breakthrough is It's irrelevant to them.
It's completely irrelevant. It illustrates the friction perfectly. The medical solution is there, in theory, but the logistics, the finances, they stop the person from actually getting that support.
It turns a medical problem into a systemic crisis.
That's it. We've optimized the science, but we have failed just drastically to optimize the delivery system and the societal support around the patient. The struggle stays because the solutions we offer are only half solutions.
So if the problem is systemic, insurance, transportation, policy, why is the proposed solution spiritual care and not just, say, policy advocacy? Is this just a policy problem in disguise?
That is a really critical question. And while those systemic barriers are huge and advocacy is needed, the sources argue that even if we fixed all of that tomorrow,
We'd still have a problem.
we would still face the crisis of meaning. The systemic failure is one layer, but the spiritual failure is the other. Cancer isn't just a disease with external barriers. It's an internal, identity-shattering trauma.
Okay, that makes sense. That's a transition from the external frustrations to the internal, the emotional and spiritual side. It leads right to this unspoken weight that the sources are talking about.
Yeah, the sources point out that while we track physical symptoms, like, with incredible rigor,
Down to the decimal point.
right, but the emotional and spiritual weight of cancer is left unspoken. That's the area where modern medicine often just goes silent.
And this raises a huge question then. How does cancer redefine a person beyond, their tumor size or their symptoms? The source material is adamant that cancer is not just a disease of the body.
It's a full spectrum crisis. It touches the absolute core of what it means to be alive, to be human. And that's why medical science alone isn't enough. The illness affects the parts of you that no amount of precision medicine can ever treat.
And the founder, through these sources, gets really specific about this. They name 4 distinct areas that cancer hits, which go way beyond the physical. Let's walk through those.
Okay, so the first one is it's fundamental. It changes how people see themselves, their core identity.
What do you mean?
Well, imagine your whole identity was tied to being strong or active or the main caregiver in your family. Cancer can strip all of that away, and you're forced to completely renegotiate your self-worth, your capability.
And that renegotiation would immediately affect the second area, which is relationships, right?
Immediately. A diagnosis puts this intense strain on everything. You see role reversals, shifts in dependency. It can redefine a marriage, friendships. The patient feels like a burden, and the caregivers feel completely overwhelmed.
Yeah.
And then the third area, which is maybe the most profound, is the challenge to your sense of meaning.
Your purpose.
Yeah, your purpose. If your whole life was about long-term goals, your career, raising your kids, a diagnosis like this forces you to ask, what matters right now? If the future you planned is gone, what gives today meaning?
And that leads to the fourth one. Their hopes for the future. Cancer doesn't just mess with your body today, it completely rewrites the story of tomorrow.
Yeah.
Hope becomes, well, a lot more complicated.
And if you connect those 4 dots, you see why spiritual care isn't just a nice to have, it's essential.
I see.
Medical care can attack the tumor, but something else has to help rebuild that shattered sense of meaning, redefine your identity, and help you process the loss of the future you expected. It's about integrating the illness into your story, not letting it be your whole story.
So this is the mission. This is the integration. To create something that can hold both the super technical science, the genomics, the drugs, and the incredible weight of those 4 areas, meaning identity, relationships, and hope.
Yes. And to talk about all of it honestly and thoughtfully.
And that honesty needs rigor on both sides of the equation.
It does. And we should pause here and really define the solution because the material emphasizes combining solid science with, and this is key, evidence-informed spiritual care. This isn't just about holding a hand.
What does evidence-informed mean in this context? Is that different from, say, traditional pastoral care?
I think the key is the rigor. Evidence-informed care is often rooted in actual research on things like coping mechanisms, resilience, post-traumatic growth,
So psychology.
psychology, logotherapy, the therapeutic benefit of finding meaning. It means using specific approaches to help patients process grief and resolve that existential distress. It goes beyond just general comfort to targeted, measurable support.
So you're taking the best clinical research on how humans cope, and you're combining it with compassionate support. It validates the search for meaning as a real part of healing.
Exactly. The focus is on providing practical, compassionate conversations. It's actionable support, things patients and caregivers can use right now, based on sound principles.
And this entire philosophy, this whole approach, it's really captured in one foundational quote from Science to Soul.
It is. The quote is so simple, but it's really transformative.
Healing is more than treatment.
That's it. That's the ultimate critique of a system that often thinks a successful surgery or good chemo results means the person is, completely healthy again.
Right. Treatment deals with the body, but healing has to restore those other four areas we talked about: identity, relationships, meaning, and hope.
And the final philosophical takeaway here is really powerful. The ultimate goal, as the sources lay it out, is finding meaning, even in the hardest moments.
Which suggests that even when the medical outcome looks grim,
Even then, even when the disease is progressing, there is still this vital human process of healing and meaning-making that can happen.
and that's where this evidence-informed spiritual care becomes absolutely essential.
Yeah.
It helps the person find value in the time they have, redefining hope away from just medical numbers.
Think of it this way. The technical science tells you what can be done to the body. This integrated care helps the person decide who they're going to be while all of that is happening.
So if we step back and just summarize this deep dive, we've explored how the launch of Science to Soul, driven by a scientific veteran, reveals this huge gap in modern oncology.
A systemic and profound gap.
Right. Precision medicine, for all its wonders, often fails to address these core human needs, meaning, identity, and just the barriers to access. And that failure forces this synthesis of hard science with rigorous spiritual care. So what does this mean for you, the listener? Well, it means that expertise in any high-tech field, not just medicine, now has to account for systemic barriers and the existential needs of the people you're trying to serve.
Yeah.
The definition of excellence has expanded. It has to include compassion.
And that expansion leaves us with a final, provocative thought. We define cancer as a crisis that hits a person's future hopes and their sense of meaning. So, if the medical system often struggles to guarantee a future, what essential role does this compassionate, evidence-informed spiritual care play in redefining hope right now, today, so that it can stay resilient and meaningful, even when the medical outcome is deeply uncertain? That's a question of human purpose that lasts long after the treatments are over.